Welcome to Focus on HR, your internet video program on human resources. I'm your host, Kathleen Koch. Coming up later in the show, we'll learn about the competencies you've said are vital for success in HR. And we'll hear what experts wish they could change about the way healthcare is practiced in the United States. But first, the news. Last episode, we told you that the EEOC, prompted by the early resignation of one of its commissioners, might quickly release new background check guidelines. The commission recently approved those new guidelines in a 4-to-1 vote. The guidance discourages employers from automatically excluding job applicants who have a criminal record. Employers instead are encouraged to analyze on a case-by-case basis whether a particular applicant's criminal history merits excluding him or her from consideration. Commissioner Constance Barker strongly opposed the guidelines, saying they exceed the agency's authority. She also thinks the rules might discourage employers from doing any background checks not required by law. A fellow Republican Commissioner, Victoria Lipnick, took a different view, saying the guidance, quote, closely tracks well-known policies. Now, she is, however, concerned that the guidance doesn't provide examples where blanket exclusions are legal, such as when child care centers automatically eliminate job applicants convicted of child molestation. For factors to consider when determining whether a criminal record merits exclusion, visit us online at www.shrm.org/focusonhr. Fewer Americans are getting health coverage from their employers, according to a study from the Employee Benefit Research Institute. While the recession is a recent contributor to this trend, the percentage of workers receiving employer-sponsored health care has been on the decline for years, EBRI found. Comparing data from 1997 and 2010, the organization spotted 3 key reasons for the decline in coverage. First, fewer employers are offering health care coverage to workers. Second, a growing percentage of Americans work part-time and typically don't qualify for health benefits. And third, even when they have the option, more workers are turning down health care because it's too expensive. By contrast, fewer workers are declining coverage because they get it from another source, EBRI found. And now for a brief message from our sponsor. Welcome back. Are you looking for someone who can help you develop in your career? Someone you can really look up to? Well, if so, you're in luck. That is, unless you stand more than 7 feet tall. This past weekend, Shaquille O'Neal, the Big Diesel, earned his doctorate degree from Barry University in organizational learning and leadership with a specialization in human resource development. The degree is not honorary. In a column in USA Today, O'Neal wrote, quote, I worked for it, and I'm as proud of this as anything I've accomplished in my life. A degree, whether high school or doctoral, is not a finish line. It's simply a mile marker. My learning will continue. I want others to come along for the ride. While his academic achievement is serious, the new degree hasn't caused O'Neal to lose his trademark wit. The title of his doctoral project, How Leaders Utilize Humor or Seriousness in Leadership Styles. If you are looking to get ahead and you don't think you'll be able to get one-on-one time with Shaquille O'Neal, you'll want to pay close attention to our next segment. SHRM recently finished an in-depth research project that looked at the competencies and behaviors needed to be successful in HR management. With more on this research and how it can help in your career development, here's our interview with Alex Alonso, SHRM's Director of Thought Leadership. I understand you're in charge of some very exciting research having to do with the competencies that HR professionals should have today. Well, what have you found, and what are some of the skills that they need to have to be a success?
So what we've learned is that individuals really need 2 core areas to be successful as HR professionals. The first is to have basic understanding and knowledge and expertise of a core set of areas, similar to what we have in SHRM's learning system. Then the other piece of it is translating what you know to business success. And the key there is having competency in a set of behaviors.
Do all these skills apply equally across all levels?
Some are more important depending upon what level you're at in your career, but they are all the most critical set of competencies. In other words, in our research, we found that these are the 9 most important competencies necessary for success as an HR professional, and that's universal across several samples. A sample of 1,200 HR professionals, in focus groups, as well as a sample of nearly 40,000 professionals via survey.
How do these compare with, for example, the criteria for the PHR and the SPHR certifications?
That's an excellent question. The SPHR and the PHR certification kind of track on the technical competencies. In other words, they assess whether or not you have the proper knowledge for success in HR, and they also assess whether or not you can apply it. The key, however, is understanding that to apply it, you have to be able to translate your HR knowledge into business success using those 8 behaviors that are critical for being an HR professional.
How did you make sure that this research really reflects what's going on in HR and business?
So the key for us was really to ensure that we had a representative sample. And the big piece for us was ensuring that we identified every industry possible, that we identified folks from every sector possible, and that we've identified folks across the globe that could participate in our data collections.
And this research was international. Did you find that the findings really applied, that they were consistent across borders?
I'd say that about 90% of what we found was very consistent across borders. So when I say that, what I mean is that the same 9 competencies were consistent across borders regardless of where we went.
So when is everyone going to get a chance to look at the entirety of the results of your research? How are they going to be used to help the profession, and what's next?
So what we're doing is we're going to go ahead and launch our competency model at the SHRM 2012 annual conference in Atlanta, Georgia. Everyone will have access to it, and it'll be available on our website also. Our goal is to serve the profession and ensure that the profession gains access to these particular competencies in this model. Beyond that, what we're looking to do is create a toolkit of a series of products that folks can use to build their proficiency in each of those competency domains. And so one thing that folks might look out for is the new SHRM competency self-assessment, which will be available in January 2013.
Great. Alex, thanks so much for joining us today.
Okay.
For links and more on the competency model, visit us online at www.shrm.org/focusonhr. And now here's a brief message about SHRM's premier event coming to Atlanta in June. As a nation, we spend considerable time and money on health care, yet you'd be hard-pressed to find anyone who says the system is perfect. So we asked 3 healthcare experts what they would change about the current system if they could. Here are their surprisingly candid and heartfelt responses.
If there was one thing I could change on the healthcare system today, it would probably be around the incentives, making sure that quality care is more rewarded than it historically has been. As you all know, really it's been incentives around volume. Frankly, we've got to continue as quickly as possible to shift to rewarding high quality value healthcare.
The one thing that I find really continues to be a frustration and disappointment is the lack of effective communication between physicians and hospitals, diagnostic centers that care for a given patient. And the number of duplicated procedures, medications, examinations, and office visits is really very disappointing because it ultimately only delays the patient from achieving their health and wellness goals and obviously tremendously increases the cost of the delivery of care.
If I could snap my fingers and change one thing in healthcare, I guess it would be team care. I watched my parents die horrible deaths, very difficult deaths. Where my father was taking 14 pills and seeing 9 doctors a day, died. Nobody was in charge of his care. That is not an indictment of any doctor. That is not an indictment of a hospital. That is not an indictment of employer. It's not an indictment of anything. The fact we have not set up a system that is focused on outcomes and truly making that difference. And that's what I would change. That every person that walks into everywhere they go, they've got a team that's taking care of them, and that we do that in the right way.
And that brings our latest episode to a close. I'm Kathleen Koch. Thanks for joining us.